Intravenous therapy. IV therapy has been one of the most revolutionary advancements in medicine. Intravenous fluids have been known to help with hydration, sugar issues, antibiotic treatment, antibody therapy, transfusions, radioactive isotopes for diagnosis, and much more. It is an important part of medicine that deserves discussion, and medical professionals should familiarize themselves with their potential. The English physician Christopher Wren experimented with injecting fluids into animals through the veins in the 17th century, which is when intravenous, IV, therapy first became popular. The first reported use of IV treatment in humans didn't occur until the 1830s, though. Thomas Latta, a Scottish doctor, successfully treated severely dehydrated cholera patients with intravenous, IV, medication. In the years that followed, IV treatment was mostly utilized for blood transfusions and to inject drugs directly into the bloodstream. Because it was utilized to treat soldiers with dehydration and shock during World War I, IV treatment spread more widely. In the 1950s, plastic IV bags and tubing were invented, making it simpler and more convenient to deliver IV therapy. This resulted in the use of IV therapy for a larger variety of illnesses, such as cancer, infections, and surgical procedures. IV therapy is utilized in various locations, including hospitals, clinics, and even at home, for patients who need ongoing care today. It is a common and significant component of modern medicine. Patients who cannot take drugs orally can receive hydration, nutrition, and both via intravenous fluids. The various kinds of IV fluids consist of: the most popular IV fluid is called normal saline, and it contains a solution of sodium chloride in water. Dehydration, electrolyte imbalances, and medicine dilution are all treated with it. However, there are varying degrees of solutions that come in salines for treating certain disorders. Lactate, potassium, calcium, and sodium are all present in lactated Ringer's solution, an electrolyte solution that is balanced. Dehydration and electrolyte abnormalities are treated with it. Dextrose solutions. These are mixtures of water and glucose, sugar. They are used to treat low blood sugar and offer energy. A balanced electrolyte solution of sodium, potassium, calcium, and magnesium is called plasma light. Dehydration and electrolyte abnormalities are treated with it. Colloid solutions, compared to crystalloid solutions, have bigger molecules that stay in the blood vessels for a longer period of time. They are employed in treating low blood pressure and blood volume expansion. Parenteral nutrition products are used to feed patients who are unable to consume food or liquids orally. They have a healthy proportion of lipids, proteins, carbs, and vitamins. To provide fluids, drugs, or other treatments directly into the circulation, an intravenous, IV, line must be placed in the patient's vein using a sterile plastic catheter. Here are a few pointers for inserting an IV. Select the proper vein. It's critical to pick a vein that is clear, reachable, and stable. The veins on the back of the hand, the forearm, and the antecubital fossa, the bend of the elbow, are the ones most frequently used for IV placement. Apply the right method by donning gloves and cleaning the region with an antiseptic solution before inserting the catheter. The catheter should be inserted into the vein at an angle of 10 to 30 degrees using a steady, smooth motion. Once the catheter is in place, don't pull it out too quickly. Aspirate a small amount of blood into a syringe to check for blood return after the catheter has been placed. Try slightly adjusting the catheter if there is no blood return. Catheter security. After the catheter has been positioned, it should be covered with sterile tape or an adhesive dressing. To keep the catheter from shifting or dislodging, ensure it is firmly secured. Following catheter insertion, monitor the patient for any issues, such as discomfort, edema, or redness at the insertion site. Additionally, make periodic checks at the IV site to ensure the catheter is still in place and working appropriately. It's crucial to remember that inserting an IV line is a medical procedure that calls for appropriate education and certification. If you are unsure how to insert an IV, ask a medical expert for advice. A newer trend that has been developing is the use of vitamin therapy for various ailments. Vitamin C, vitamin B12, and vitamin B complex are the vitamins that are most frequently utilized in IV vitamin treatment. Calcium and magnesium are two other minerals that could be added to the IV solution. Depending on the demands of the patient and the intended outcomes of the therapy, a specific vitamin and mineral combination may be employed during IV vitamin therapy. IV vitamin treatment is promoted as a way to increase energy, strengthen the immune system, sharpen the mind, and lessen the symptoms of a number of illnesses. There is, however, little solid scientific proof to back up these assertions. Despite being largely regarded as safe, IV vitamin treatment does include some dangers. Vein irritation, infections, and allergic responses are examples of potential adverse effects. Only licensed healthcare professionals should perform IV vitamin treatment, and patients should speak with their doctor about the procedure's risks and advantages before having it done. I hope you enjoyed this video and feel a better understanding of IVs and their medicinal use. Please consider subscribing. Thanks for watching.